Didn't already? There we go. Okay, recorded. So welcome. The date today is August 18th, 2022. We're going to talk about COVID. We're going to talk about monkeypox. Some of that might be out of date if you're listening to a recording. So go ahead and log on to cdc.gov for the most up-to-date information. So while these poll results are kind of trickling in and folks are still logging on, it looks like too. We are going to switch things a little bit today. Our COVID, Dr. Nick Staub is going to be on with us and give us a COVID update. And he's also going to talk about monkeypox, our newest Arizona outbreak. Then we are going to play a game and look at some pictures of diseases, which nurses love and I get really grossed out by. And then we're going to talk a little bit about team-based care. So, and Dr. Nick, I will turn it to you to give us an update. And in case you're curious, I'll share the results here. Looks like people are most people are about the same busyness and craziness, or maybe even a little bit busier than normal this year for back to school, which is great. It means that you're catching them up on all those other vaccines too. So.
Hey, Rebecca, can you hear me?
Yep, I hear you.
All right. I apologize. I don't have any slides to accompany my report, and I'm kind of double dipping in meetings right now, but I'm happy to be here. So we do now have 188 cases of monkeypox here in Maricopa County. The outbreak is currently happening in just one specific population. So it's primarily affecting men who have sex with men, so gay, bisexual, trans women. And we have so far, all of our cases are occurring in men and really do seem confined to that particular population. So what we have been communicating out about this monkeypox outbreak is that the general public at this time is not at risk for monkeypox. While anyone can get monkeypox, it is spread in such a way requiring close skin-to-skin contact, often intimate contact, that we're not expecting to see spread outside of this particular group. Again, not saying that it's not possible, but that's not what we're seeing right now. So our effort here in public health is to get vaccine out to those who are at highest risk. So household members and social contacts of cases of monkeypox, as well as those who have social risk factors that put them at high risk of encountering monkeypox. So we are actively vaccinating that group of people. We are encouraging that anyone with the new rash who may have been exposed to someone with monkeypox or who, again, is in this high-risk group, that they be tested. We've been asking all of our providers out there in the community to provide testing, which is now available at commercial labs. So it's relatively easy to get access to testing. Monkeypox, unlike COVID-19, again, different in how it's transmitted, but also it's not a new disease. So we have vaccine that is effective for it. We have treatment for it. Most cases of monkeypox do not require any treatment and they resolve on their own, but an individual does need to isolate away from others while they have it. So again, public health is doing case investigations and contact tracing of all new cases, so we can get that information out to people. It's really important if you are seeing cases of new rashes in your clinics, that you're kind of investigating those other epidemiologic criteria that would really make it more likely to be monkeypox as opposed to any other rash illness, many of which can be confused for monkeypox and vice versa. In terms of COVID-19, our community level is currently low. Our numbers of reported cases to public health are slowly coming down. And so the guidance for masking, testing, staying up to date on vaccines all follows that low community guidance. However, the community transmission level, which is what healthcare practices are to follow and which is calculated in a different way and takes into account different considerations, is still at a high level. So there's really no changes in terms of what is recommended by CDC for offices and for healthcare providers working in a healthcare setting. So still masks on, and then gown gloves and eye covering when you're treating a possible COVID patient. which is good because it also protects you from monkeypox should you incidentally come into contact with a patient with monkeypox. The last thing I'm going to address here briefly is the availability now of Novavax. So it's the latest COVID-19 vaccination that's been made available. It is available in limited supply around Maricopa County. Some Costco pharmacies are carrying it, as well as our county immunization clinics. But this vaccine is kind of considered an older technology, not a quote unquote new technology like the mRNA vaccines. And so we expect that there are some people who may be more willing to get that vaccine type. So that is my brief review. I apologize, Rebecca, I got to fall off to another call, but thank you for having me today. If you have any questions, Rebecca, please forward them to me and I'd be happy to answer them.
Thanks, Dr. Saab. We will do that.
Thank you.
So I know that Maricopa County, Coconino County, and Pima County are all doing a lot of outreach right now on monkeypox. So just let us know if you live in those counties and want resources for your patients, or make sure that you're getting the alerts from those counties, especially who are distributing vaccine and treating, distributing vaccine. And then Macrina, another big thing that happened while we took 1 month off was vaccine became available for kids down to age 6 months, which is what we've all been waiting for. And we are interested, and I'll give you a minute to read the results of this while Macrina turns on her camera. We're interested if you're offering COVID for pediatric patients. If yes, like, are you doing it at every well visit, every sick and well visit, only if they ask for it? Depends on the provider. We just would love a little temperature check on how that's going. And for those of you who are saying no, if you could let us know why not, either on chat or email us afterwards. We'd love to just kind of make sure that we know what the barriers are for offices right now to offer this vaccine, because for those of us who work in the community and in public health clinics, we just feel we know that most of these families, especially of young children, really want to hear their child's physician, nurse practitioner, provider say this vaccine is safe. So we're trying to think of what's the best way to support offices in recommending the vaccine and offering the vaccine, especially as we expect more COVID vaccines to come out. And, this will become just part of our regular kind of day-to-day. So not enough demand. Yeah. Another person is private messaging saying they're waiting for full approval for kids. Well, Macrina, give us the lowdown of the baby vaccine. All the baby vaccines.
Okay, so, and I'm sure that a lot of this COVID is not easy to manage. So I feel all your, but both Moderna and Pfizer have vaccine for 6 months and up. One thing that makes it a little confusing is that Moderna is for 6 months through 5 years of age, which is different than Pfizer. So with Moderna, it's 2 doses separated by 4 to 8 weeks. If you have a patient who is moderately or severely immunocompromised, you want to use the minimum spacing of 4 weeks to get them their second dose. The vaccine vial cap is blue and the border of the label is magenta. So the color, they're trying to change the colors to make it a little bit easier. But for someone who actually does give vaccines, the best practice is to always read the vial. It does not require dilution and it's a 0.25 mil administered IM.
If I hear this question one more time,
yes,
what do I do?
I know. This is really no different than any other vaccine, right? We give DTaP through age 6 and then we move to TTaP at age 7. And if they're in the middle of the series, you just give them the vaccine for their appropriate age, which is exactly what you're going to do with COVID vaccine. If the first dose, is if the child is 5 and turns 6, then what you're going to do is you're going to give them the first dose age appropriate, which is at 5, and then the second dose at 6, which is the age appropriate dose.
So same as whatever the other vaccine,
Same as whatever we routinely do.
like DTaP to Tdap or,
Correct.
yeah.
Correct. Same with if you're giving, you know, Hep A or Hep B and they age up. Here is,
This is the link for that.
this is the link and it'll give you everything baby Moderna vaccine that you need to know. And then Pfizer is through 4 years of age, up to 5. Now their vaccine is 3 doses. It's 8 weeks between 1 and 2, 8 weeks between dose 2 and 3. Again, moderately to severely immunocompromised, you're going to give it at the minimum spacing, which is 3 weeks for both doses. This one is the vial cap and the border are both maroon. Dilution is required on this. 2.2 mils of 0.9% sodium chloride, and this is a 0.2 mil dose that is again administered intramuscularly. Yes, you can actually, they recommend, I can check on that, but I believe they recommend sticking with the same manufacturer. But if one manufacturer is not available, you can, you know what I want to say, right, Rebecca?
Yeah. So try to stick with the same manufacturer, but it is the same technology. So you can swap if you have to. So if you get a patient who received a Pfizer, but you're only carrying Moderna and they're due for it, then we think, well, let's double check that.
We're going to double check that. And then with Pfizer, it's the same thing. If they age out, you're just going to change and go from the maroon cap and border to the orange cap and border.
Macrina, can you talk about the recommendation? Somebody's saying, why not ASIIS recommended? I mean, it is recommended by ASIIS.
It is recommended by ASIIS. ASIIS recommends that all children get immunized with COVID vaccine. So I don't know. I think
is it still under authorized
It's
use?
still under emergency use authorization. I also know that some of the concern from providers and parents is that the protection is not as it's not as robust or as high as you see with adults and older children. But again, any protection is better than zero protection.
Well, and I think there's a couple comments, and here's the link for you about aging with Pfizer, aging out with Pfizer, or switching age groups with Pfizer. You know, there's a couple comments in there about demand. And one of the things that we've learned, and we learned this a lot with HPV and unfortunately learned it the hard way, that, you know, knowing that your child's doctor or provider offers that vaccine actually does help increase demand, because they may not have really given it serious consideration to get the COVID vaccine, but when they're offered it at their well visit or sick visit, or when they're going in for their sports physical, maybe they say no, but seeing their provider believes in this and has the product there and wanted to take the time to have the conversation does help that parent and that family go home and think about it a little bit differently, and they might make a different decision on the way back. And we saw that work with HPV. So I know I do recognize that the demand's small, and that's not unique to Arizona, and it's not unique to your rural community. I think that last I checked, it was, I mean, still under like 2% nationally, wasn't it? In this age group.
It's still really low. And I think the other,
Very low.
And it also happened with HPV, the fact that everyone was going to wait till they knew someone who got vaccinated or until more children were immunized. And so I think the best thing is that for any of you who have immunized your young children, and please share positive stories about children, there were not any severe adverse events. You know, my child got exposed or got COVID, but had mild symptoms to no symptoms. I mean, share these stories with everyone you know, because the more people hear, not only from the provider and you in the office, but the more they hear from their family and friends that there was no problems with it, and that it actually, that 30 to 40% protection that they're documenting is good, because it stops babies from getting severely ill and hospitalized. So I think the more we share those positive messages, the more likely parents are going to feel more comfortable.
Yeah. And the quicker this vaccine is not going away. The disease is not going away. The vaccine is not going away. So we really, eventually we really hope that everyone will be offering it to all of their eligible patients. And the quicker we can do that, the better to help improve demand. And I know we all want to do it, but I didn't mean to stop sharing that, but I also know that there's like serious logistical things.
I recognize your logistical concerns as well.
Yeah. And with, somebody else, it is super complex.
Yes, it is.
And if you've had a lot of turnover in the last year, I mean, there are real reasons why you're not offering it yet. We know that. Let us know how we can support you to get it in your fridges, because Macrina cannot do it with her nurses in Maricopa County. And we have the whole rest of the state that we need to do too. So.
Yeah, and I recognize that this has changed vaccines totally. This is almost like engineering in your practices.
Yeah.
Here is some interim considerations and some guidance from CDC. They have updated it completely. There are so many job aids that are going to help. In fact, when I walk into clinics, I see them all posted along the wall to help decrease errors so they can have the answer quickly. And there's a lot of infographics that make really implementing all these COVID vaccines a little bit easier for your practice.
So Dr. Nick talked a little bit about Novavax.
So Novavax, it's again limited vaccine, has actually the same safety profile as the Janssen did. This is for 18 years of age and older. It's 2 doses, 8 weeks apart. It's refrigerator storage between 36, refrigerator storage. Once you puncture the vial, it can stay out from between 36 to 77 degrees Fahrenheit up to 6 hours. You need to toss all doses after 6 hours. Once the vial is punctured, you're still not going to shake this, just swirl. It's 0.5 entered IM. And this is just for the primary series. There is no booster at this time for this vaccine. So if somebody comes in and wants a Novavax booster, no, it's not licensed currently for that. They would need to go with either Moderna or Pfizer. We really do think, in fact, when the FDA first approved this vaccine, the county health department received about 6 calls very quickly, because there are some folks out there that still want old-fashioned technology.
Do you know anything about the Omicron booster? I thought that I forgot to ask Dr. Nick. I just saw it in my notes.
So all we know about the Omicron booster is they say that it's coming in September. We know that the United Kingdom, the UK, has already started administering this vaccine, I believe Monday, over on the other side of the pond, as Rebecca likes to say. We do know that this is going to be a little unique, because we just saw a story that they're testing the efficacy of this vaccine on mice. So there are no human trials. It will be mice trials.
Which is what we do for flu, right?
Right. I was just going to ask how we ensure that the strain that we put in the new flu virus. I think the difference is that we routinely reuse strains that have been used in the past.
Okay.
Right? So these are not necessarily new strains we're putting in flu vaccine. We're just putting in these strains of flu vaccine because that's what we see in the Southern Hemisphere. In our summer, their winter, we put in the strain. So I believe this is how they tested flu vaccine in the past. But I think that could probably be the most common question we get, is how do we know it's efficacious? But it is coming. It'll hopefully come in September. And again, I believe that any protection is better than no protection.
All right, anybody have any other COVID questions before we get to the other vaccine reminder stuff? All right, so just a couple quick reminders. Don't forget your vaccine matchmaker app if you want doses under 100 doses of any of those COVID vaccines. Another reminder is that VFC re-enrollment is open now until August 31st. You have to re-enroll by August 31st. So be sure to do that if you haven't done it already. And then another change that happened in the last few months is that there's new incident reporting. And I think Laura Smith is going to post a link in the chat to ADHS about this. I'll just read from their website. So there's now two options if you have a temp incident, a temperature incident. Option one is to submit an incident report form to IPO, and they will contact the manufacturers and let you know within 4 to 5 business days if the vaccines are viable. So that's what you've been doing already. But and the new option, option two, you contact the manufacturers yourself, and then you complete a temperature incident instruction form from ADHS. So you still have to notify IPO, but you can contact the manufacturers yourself. That temperature incident instruction form will ask for viability statement and supporting data logger information. And then you can continue to use any viable vaccine. So that link is in the chat now, but that was a welcome change people were excited about and asked us to make sure that we made an announcement today. So. Oh, and another thing that we keep hearing is, well, I don't have room in my fridge. So this, how many doses is this?
These are 100 doses a piece.
So it's very small.
It's very small.
Yeah.
Does not have much space at all.
All right. Anybody have any other questions, or can we play our game? We ready to play? Okay. So back to school season is always crazy. You are so busy with appointments and parents pleading to your front desk to let them please sneak all of their kids in who are due for vaccines so they can send them to school. We know that it's really crazy. And we thought it would be fun to just kind of regroup as a group to say, why is this stuff important? And remember that you are protecting the community from these really awful diseases. So we're going to share some very ugly pictures that the nurses will not bat an eye at. And feel free to like unmute yourself, share your stories. I have 15 prizes I'm allowed to give out that we will coordinate on chat about how to mail them to you. But yeah, so let's just have fun with some diseases. So what is this disease? You can unmute yourself, chat, do whatever. Somebody take a guess.
Come on, somebody knows.
Oh, Jennifer Miller says pertussis. Nope, not pertussis. Flu. Oh, Pelican Private gets Antalya. One of the, whoa, all these flus. Laura, contact people for prizes. That is a very scientific phrase called the snot cloud or the booger cloud. But yes, that is influenza. And it's one of Marina's favorite diseases.
Well, because I just don't think influenza gets the respect influenza deserves. I think everybody calls everything influenza. They have a headache, they have a stomach ache, they have diarrhea, vomiting, mildly sick. They all call it the flu. And then people say, why should I get immunized against something like that? Well, because I've had the flu. I was down sick for 2 weeks. I lost 15 pounds and was a hard way to do it. Flu is a severe disease. And I just think it doesn't get the respect it deserves. That's why we have a vaccine.
Okay, this is an easy one.
Yep.
Mumps.
Mumps. Yep. Anybody have a good mumps story?
Okay, I will tell you how my mother diagnosed my mumps, because I was a child before.
Had mumps, Macrina?
I had mumps. And it was before,
Macrina, there was no vaccine for it, huh? Back then, way back then.
yes, way back then. And so I came home from school with some slight swelling and fever and slight fever, just not feeling 100%. And so my mother's girlfriends, all from the neighborhood, were sitting around the table at about 3:30 in the afternoon, and they were having their Coca-Cola hour before all the husbands came home, the old days where the mom stayed at home. And so they all started to talk to each other, and they thought it was the mumps, but some wives' tale said, have her eat a pickle, and if she takes a dill pickle and her glands, right, where the poor gentleman is swollen, hurts, then she has the mumps. So I took a bite of the pickle and it was very painful. So my mother and her Coca-Cola girlfriends diagnosed me with the mumps.
Oh, wow. Oh, well, Linda's sharing a good story. At a fertility office, one of the sperm donors got mumps while working in the research lab. Could no longer donate and couldn't have children. Wow, I didn't realize that mumps, I think that is ringing a bell now. A lot of these vaccine preventable diseases cause fertility problems. Cirrhosis, hepatitis.
Yeah, this is cirrhosis from a failing liver due to hepatitis B. One thing we all need to remember is that there's a new general recommendation that in the height of COVID made it through the ACIP, is that now it's a general recommendation for all adults 18 through 59 to receive the hepatitis B vaccine. So this is where if you immunize adults, it's important to check ASIIS, because some of those younger folks are going to have the vaccine. Probably some of those, as they get up to middle age, might not, depending on their career choice. Most healthcare providers will, but definitely check records for hepatitis B, and now it is a general recommendation. Folks 60 plus, you're only going to immunize them based on risk factors.
Okay. So make sure that that's in your screen, when you're doing your chart preps and things for all your adult patients, for sure. And that, Macrina, is that her stomach?
That's her stomach. So what happens as your liver fails, toxic fluid builds up in your abdomen. And so what happens is that's as her liver is failing, her abdomen is just filling up with fluid. She died a few days after this picture was taken.
Who has a guess of what this one is? Polio. Polio's been in the news lately, so you may or may not have seen, there was a case that came up in New York State, so in Rockland County, a county that was unfortunately hit by a really strong measles outbreak right before COVID, I think in 2019. A man living in that county was probably exposed to someone who had the oral polio vaccine. Apparently he was had just had a wedding and a few days later was hospitalized with polio. It takes a few hundred cases usually for someone to get paralysis. It's not every person who gets polio doesn't get paralysis. Unfortunately, this 20-some-year-old guy did get paralysis. The first case here in decades. It says nearly a decade on the headline. So, and now polio virus has also been detected in the wastewater in New York City. So hopefully this will not be resurging. Again, our polio coverage rates for children are actually pretty good. I mean, over herd immunity. And that oral polio vaccine is a really good vaccine in preventing spread of disease, but we don't use it anymore in our country, right, Macrina? Because it does create that 1 in a million people will develop.
Correct. Why we stopped giving oral polio was because we were seeing more vaccine-associated paralytic polio disease. So we moved from oral to injectable.
Mm-hmm. So hopefully this doesn't come to us. If it does, as of now, our herd immunity coverage levels are pretty good. Okay, so this one's a little tricky. So who has a guess of what this one might be? pertussis. Jennifer has a favorite disease, I think. We've found her favorite disease. It's not pertussis.
Okay, so think of a disease that in my lifetime, and as Rebecca keeps telling everybody, I'm old, I'm 58. So in my lifetime, when I first started working in immunizations back in the mid 80s, there was not a vaccine for this disease. Now we immunize children routinely for this disease at 2, 4, 6, and 12 to 15 months.
2, 4, 6, and 12 to 15 months.
15 months. We give this vaccine.
Salvarado.
Yes.
Yeah.
Way to go. Yep.
Yep. It is Hib. This one, so when you were in nursing, when you started Macrina started her career at PCH, right?
Correct. So at PCH, we would, our pediatric medical residents would get more than enough experience doing a spinal tap on children. It's because at least 2 to 3 times a night, we'd have a child come in with a fever of unknown origin, and we would have to tap them to see if they had meningitis caused by Hib. We would see several children admitted to the hospital every week with Hib disease. When I first started with public health, there was no vaccine available. Then shortly after, there was vaccine available. Today, very seldom do medical residents have to do spinal taps on children. In fact, most of them don't even have the availability of a child that needs one within their residency, because this vaccine has almost wiped out the disease completely.
Yeah, my boss is a pediatrician and talks about during her training, like similar stories, that this was when you'd be in the AD for your rotation, you just did like spinal tap because of Hib, because it was just all over. So what a great, that's a quick turnaround that we've made that. Oh, I hate this picture, Macrina.
I know, I do too.
It looks like a dinosaur. Like,
I know.
Anybody have a guess of what this awfully painfully looking?
Yes, you are absolutely correct. Meningococcal.
So is this this is obviously an infant.
This is obviously an infant. Where we are more likely to see severe meningococcal disease is in our adolescents and our young adults in the college setting. But what happens is that the blood vessels start to break down and they stop getting blood flow to their extremities.
So this child more than likely lost
More than likely lost that foot.
And then there's Punky Brewster is doing meningitis campaigns now. Did you see that? She's like partnering with GSK on Men B awareness. What's her name? Salil Moon. Do other people remember Punky Brewster? Do you know who that is, Macrina?
I know who Punky Brewster is. Yes.
Okay, here's my people. There they are. We know.
Yes, I do.
Punky Brewster is a big fan of Men B vaccine, so has started doing some outreach with GSK. She apparently is the parent of 4 teenagers and didn't know about the Men B vaccine, but has started getting it. So we love any celebrity who likes vaccines. Okay, what is this? And how is that person breathing? It looks, does that look like, is that what strep throat looks like, only smaller?
Yeah, Jennifer's got it right. It's diphtheria. Yeah. That's what causes the bull neck. That's what we call that really swollen neck on that little girl or little, is a bull neck. And usually that is a really good indicative sign of diphtheria. We don't see diphtheria very much at all. About once a year, we will get a case that we investigate. And very seldom does it end up being diphtheria, but that's because we are still vaccinated.
How do you get diphtheria?
Close contact.
Okay.
Yeah.
Are we just supposed to not touch anyone anymore?
Well, this is a little bit closer contact than touching.
Okay. Yeah, that looks really painful. Okay, what is this one? Cute little baby eyes. Hepatitis.
This baby has cataracts.
Meningococcal. This is a disease that was the leading cause of blindness. And I think, does it cause deafness as well?
Yes, it causes severe cardiac anomalies. It's something that hopefully most people are immunized with.
Amy Reed.
There we go. There we go. Yes. So this is why we still do rubella screens on all pregnant women.
Yeah, when do you see that? Like, when was the last time you've seen?
The last time we saw congenital rubella was probably, I did at the health department, was back in the early 90s. And we actually had 3 young women who were exposed at the same time at the same gathering. And all 3 babies had different outcomes.
Oh, wow. So it's mild kind of flu-like symptoms for grown-ups or kids who get it.
Right. So it's a mild rash. It's usually mild fever. It's usually nothing that as an adult you're going to get overly excited about. But if you do contract rubella while pregnant, it can lead to severe birth defects in babies.
What is that?
Ooh. That is pus on the brain.
What is pus?
Oh.
Meningitis? Like, is it just? Does it come from HPV? No.
No.
Any other guesses?
It's something we immunize against.
Yes, these are all preventable.
These are all preventable. This one, we routinely immunize babies.
Oh.
And then we routinely immunize older folks.
Yellow fever, good guess. Not the right answer, but
Right. So babies get vaccinated and 65 plus get vaccinated. What?
Polio, no. PCV, pneumo.
Pneumo, yes.
Pneumococcal.
Meningitis. Uh-huh.
And it impacts your brain, obviously.
Yeah. Well, yeah, if you get pneumococcal meningitis.
Yeah. Okay, what is this one? Couldn't type fast enough, tell you so. She wants her prize, Laura Smith. What's this one? Tetanus. Yeah, poor baby.
Yep.
You know, this is neonatal tetanus. Yeah.
Correct. This is neonatal tetanus, which means that at the time of birth, they used a dirty tool to cut the umbilical cord.
We had a case, I think it was before COVID, so it feels like
Yes.
last week, but it was like 2 years ago, 3 years ago, of a home birth. I think it was in another state, but a home birth, the midwife urged the parents to put clay on the umbilical cord for healing, and the baby got tetanus because of that recommendation. So this awful disease. Okay. What's this one?
This is my favorite vaccine preventable. This is my favorite vaccine.
Oh, everybody's getting it right. Hepatitis.
Yep.
Why is it your favorite vaccine?
So again,
I like this story. I've heard this story.
So Maricopa County was #1 in hepatitis A cases. #1
In the country.
More cases than anybody. And we were seeing in both children and adults. And so this is why you do actually surveillance on disease, because then you find out the population. So when children get hepatitis A, they have extremely mild symptoms, but as you get to be an adult, the symptoms are more severe. So we were seeing a lot of adults with hepatitis A and discovered that the connection between all these adults with hepatitis A were that they either worked in childcare or their children attended childcare. On the other hand, we had an entire program of nursing staff that all they did every single day was go out to childcare facilities and administer immune globulin, because at that time, that's how we were stopping outbreaks. So we decided to go rogue and worked with county leadership and the state to institute a hepatitis A vaccine requirement in childcare setting. And our rates within 18 months went from crazy, ridiculous to the top of the list to being at the bottom of the list for hepatitis A in childcare facilities. So this is proof that policy works. The thing with policy is that you need to collect the data. We did, and now we just.
We've certainly learned that, that like, requiring people want to do the right thing, but sometimes you kind of have to. Those policies and vaccine requirements are just such a huge driver, because it's so hard for us all to prioritize things and make those appointments and get in. So if you have to in order to go to work, those parents are much more likely. Who has a guess on what this one is? Varicella. Yep, that is a chickenpox in that child's eye. Not very much around. You can see that there's not a ton of pox around the eye, but that child was very unlucky and got a chickenpox in the eye. We work with a mom who had had chickenpox as a child and decided to not vaccinate her kid. She was fine, so she didn't vaccinate her 5-year-old for that. He went to school, he got chickenpox, and he brought it home to the infant sibling who ended up getting a bacterial infection, a MRSA, in a POC, and spent a few weeks in the PICU. So chickenpox, yes, many of us did have it and are just fine. Maybe there's a scar somewhere, maybe there's not, and that's all that it looks like, but it can be a very, very devastating disease. And there's just a lot more like antibiotic resistance and just stuff floating around that you don't want near open sores. And the other thing about varicella, about getting chickenpox, is that means that you can also get shingles.
Yes.
When you get older, and we don't get to get that shingles vaccine till we're 50. So but you can get shingles before then. So if you don't get chickenpox, you can't get shingles. So. Okay, I think this is their second to the last one. I'll give you a hint. It's Jennifer Miller's favorite disease. Pertussis. There it is. How can you tell that that's pertussis, Macrina, in that picture?
Well, what I can tell is the little kiddo that's on the right, you could tell how his ribs are sucking in, how he's trying to get air. He just can't catch enough air. He's coughing so much. And the other little one has all sorts of little bubbles and slime in their mouth.
Yeah.
These poor kiddos, it is probably the hardest thing to watch as a little baby with pertussis. And I think the most important thing is that babies are getting pertussis. We can solve this problem this problem is solvable. We need to immunize all pregnant women in their 3rd trimester. That baby needs to be born with some protection. And we need to make sure that everyone around that baby is immunized against pertussis, because who brings pertussis to these babies are us adults. So that I can't drive that home enough.
Sternal retractions. They're saying that's what that is. That looks like, ugh. Okay, and what's this one? Measles. there is an awful measles outbreak going on right now in Zimbabwe. And this is a headline from 3 days ago. Not seen, obviously, their healthcare system looks really different than ours. But they've had 157 children have already died within their current measles outbreak. Unvaccinated children that all belong to the same religious sect. So certain churches saying that are giving misinformation about vaccines to their congregations. So always a plane ride away. We've had too many measles outbreaks.
And measles is one of those diseases that amongst an unimmunized population will spread like wildfire. It is very virulent. This virus it really wants to infect people, and it will find those unimmunized folks. This is probably the vaccine preventable disease that scares me the most, because it will spread like crazy amongst an unimmunized population. And we know that, at least I know that in Maricopa County, a lot of times your zip code will reflect how well your population is immunized.
And we are below herd immunity levels in our pediatric populations for measles in many zip codes. So this is definitely one of those things that keeps Macrina up, I'm sure, and all of us in public health, is measles. Because another thing that is with measles is that a lot of our providers don't know what it looks like anymore because they've not seen it, just like what we were talking about with HIV. There's a great story of that. Well, it's not that great of a story, but of the measles outbreak in 2009. Started with a European person who came, felt really sick, went to several urgent cares and a doctor's office before they were diagnosed. And there was this old, about to retire, should have retired 10 years ago nurse who heard all of these doctors talking about this patient that was in an exam room with all of these symptoms. And the nurse walked into the exam room, flicked on the lights. The patient went, flicked off the lights, walked away. And she said, it's measles, because one of those symptoms is conjunctivitis and eye sensitivity. It's very low, you go through a lot of other questions and things before that, but that patient was on steroids, so had no rash, never got that telltale measles rash. So, and the patient did have measles and started a measles outbreak in that stayed contained in Southern Arizona, but very scary disease. But we don't share those pictures and diseases to gross you out over your lunch, but just to say what you do is so incredibly important. These are real diseases, they're real people, they're real children, and they're real lives that you get to save every single day. And each one of you has a really important part in that. We're going to spend just a couple minutes talking about team-based care, because this is really where the rubber hits the road, right? So we all want to rid the world of these diseases. We hope that all of our patients and families choose to get vaccinated. And one of the ways that we can do that is by being a safe place for them in your exam room, in your office, for families to share their concerns, share their questions, and make sure that everyone on that team is able to address them. So when we see team-based care, there's a couple key concepts. First is that we're partnering with the family on making their own care goals, right? We want to make sure that we're patient-centered and family-centered. And another really important concept to remember is that everyone's working to the maximum of their ability. So those medical assistants, and I know we always play Hug an MA Day at TAPI, you are allowed to answer questions. I feel like, especially over the last few years, we've seen a lot more people saying, oh, just wait till the provider comes. Like, you have a question about vaccines, just wait till the provider comes. But your ability to say, vaccines are safe, or yes, I decided to get my child vaccinated against COVID, and the provider will be able to answer all of your questions. Your ability to say those things is incredibly important, because it helps show that everyone in that office is promoting vaccines. At team-based care, the evidence says that there is a reason. It's not just about making patients be able to fit their, oh, thanks, Macrina, for that clarification. It's not just because it's good for patients and improves, quality of care and patient outcomes, but it also decreases your workload when everyone operates to their scope and increases efficiency. And most importantly, it decreases burnout and turnover. We know we have been talking with a lot of you offline about turnover and onboarding and lots of people, just kind of reassessing what's important to us after the pandemic and what kind of jobs we want and how far we want to sit in the car on the way to work and how many days a week we want to make sure that we're home for dinner. So we know that turnover is happening, and when everyone is working collaboratively, patient in the center, doing the most that they can do to the maximum of their education and certification, turnover and burnout does decrease. So this is a reminder. This is a graphic from MAGMA, which is the Practice Managers Association, and just kind of shows all of the different people that are involved in team-based care. We want to, it's a big concept, and and there's lots of kind of how-tos, but I think what we hope that you can walk away with today is just a couple reminders of what everyone can do to help incorporate team-based care into your vaccine delivery process. The first is to make sure that you practice open communication. Like when you see someone do something really great, celebrate it. So somebody identified a temp excursion, or that, isn't the VFC coordinator or the backup, but walked past the fridge, looked at it and saw something funny and said something, celebrate that person. And making sure that when conflicts come up or processes aren't working the way that you think that they're supposed to be working and how they're designed, to say something, and make sure that you tell your supervisor, and make sure that that we can air out all of those things. A second thing that we want you to think about is how can you keep patient experience at the center of everything that you do. And with vaccine delivery, one thing you can do is walk through the immunization process yourself. Who is the first person that talks about vaccines to a patient? It's usually the person who schedules the appointment, right? Especially for those 2-month visits, or maybe an adult who hasn't been in a really long time. It's been 5 or 10 years since they've walked into any kind of a healthcare process or healthcare facility. They're nervous about their vaccines, and it's the scheduler, it's the person at the front desk. Those are the folks who really say things about vaccine first. Our third big tip is, remember, training is not just for you. Everyone who touches vaccine needs training about storage and handling. Annually, when vaccines are added to the schedule or when the schedule changes, everyone needs training at onboarding. And everyone, even if they're not involved in your vaccine delivery process, really does need to know that this is important. It is a core part of your business. It's a core part of what it takes to keep your patients healthy, and make sure people know how to talk about vaccines. Team-based care is supported by data-driven decision-making. You all have a million reports about vaccines, about coverage in your patient population, about well visits and coverage, about your COVID vaccine rates, your flu vaccine rates. Please look at all those reports. You run all of those reports, look at them, do something about it. If you are working on an improvement project, it's really easy to say, we're really trying to get 10% of our baseline. We're all committed to getting that. Once you're already at your goal, it's really easy to forget that you want to stay at your goal. So be sure to look at your coverage. And that really needs to be the whole team, because it is the whole team's ability to make those things, to make your vaccine delivery system run. We want to remind you to do your evidence-based interventions. These are the things that CDC has data on that suggests that if you do these things as an office, you will improve coverage rates. So reminder recall systems, maintaining your data quality in ASIIS and in your EMR, adding your historical stuff in and making sure that you clean your data, get rid of your patients who have left you, your old patients. I say get rid of in the quotes. Standing orders as an evidence-based intervention, giving that strong provider recommendation and saying that I strongly recommend you get this vaccine, and screening for vaccines at all visits, sick and well. And finally, make sure, that your office has a commitment to providing family-centered, culturally appropriate care. And for many of you, you are the ones, the person that your patient sees during that whole visit that looks like them, can speak their language and understands their community and what their values and morals are. And it's really important that when a provider is not sensitive to those things that that family needs, that you say something, because it is all about the patient's comfortability with those recommendations, and the patient and their family are the ones who have to follow through with those. So making sure that we can stop and pause and learn about the different people who we're caring for is incredibly important. And if you're a member of that community, helping to give voice for your patients is really important. And next month, we're actually going to start with this kind of family-centered, culturally appropriate care theme. We are going to have with us some representatives from the disability community who are going to come and talk with you about what offices do to make their families feel welcome and supported in well care, sick care, and in making sure that they get vaccine delivery. So we're really excited to welcome some special guests. You won't hear as much from me and Macrina next month, but you're probably sick of us, even with having a break last month. But that is going to be kind of our theme for next month. We also, next month, September 1st, we have a training called 10 Things Parents Need to Know. This is something we do quarterly. Feel free to send it out to your patients, post it on your own practice social media feeds. This is really geared towards community health workers, social workers. You're welcome to come on too. You'll probably hear a couple tips about ways to answer questions, but anyone is welcome to that training. And I think that's it. We're at about 1 o'clock. We will keep the line open for just a few minutes because people might have questions. And otherwise, we hope that you enjoy your back to school rush. We're glad it's rushing and that you're really busy. Are you really busy in clinic, Macrina? Are you about the same or?
I think we're probably back to pre-COVID numbers.
Good.
Yeah.
That's great. Oh, we're getting lots of love.
Oh, thank you.
Thanks, guys. We love you all too. And Macrina did clarify that we do need to use the same vaccine product, so they can't.
They recommended for both children and adults that you use the same product for primary series.
But can you? I mean, we used to be able to for adults, right?
We used to be able to, and I know we can with children, even though the recommendation is, but never miss an opportunity to immunize. Find anything.
Right.
I could always ask the expert.
Yeah, maybe we'll do that.
Yeah.
And actually, since we always here, I will do that while. If you have not used Ask the Expert yet, it is Macrina and I's favorite thing. It's my favorite thing CDC offers. Okay, so I'm going to go to Google. I'm going to do, well, whatever, you can see all these things.
Because everyone will always ask a question. You're just really good about everything you know, but I'm telling you, someone will always ask a question that you just don't have the answer to.
Yep. So you go to CDC, Ask the Experts, you go here, and I don't ever look at any of this. They have everything logged, every answer, but I just go right to this email CDC, click that, and then I email them my question. And usually they get back to you like within, well, of course, right now my email's not wanting to do that, but they usually get back to you within like an hour. I mean, I think they say it will be 48 hours or something like that, but it's usually like immediate. By the time the patient were to leave your exam room, usually they'd get back to you. Like it's really fast. And it's doctors and nurses and people who just sit there all day and no vaccine questions from CDC. Anybody else have questions or stuffs today for us? All right. Oh, lots of love. I think we needed love today. McCreen is sick of monkeypox already, so.
It's like it's just one thing after another.
I
right?
know, Hep A, I remember. I thought we were in a Hep A outbreak. Oh, no, now we're doing a pandemic. Now
Yeah,
we're
we
doing
were
monkeypox
at
now.
some point. That's how you end one outbreak, though, is get another one. That's why I love doing these, is because I get to talk about baby vaccines and regular vaccines.
Yeah,
It kind of centers me and brings me back to what my love is of public health.
yeah. All righty, well, we will, oh, good. Oh, thanks. We love you guys. We are really excited about next month, so don't miss it. We've been trying to partner with these folks for a while to do something like this, to, you know, give some voice to some of the disability community and make sure that they can share everything that, you know, that they hear with all of you. So we're really glad to do that. And yeah, we will see you all next month. So thanks, everybody.